Welcome back to the Atlas of Chiropractic podcast, part 3 of a 3-part series on interpretation of NeckCare data in an upper cervical model. And the links for part 1 and part 2 are there. So we discussed already range of motion, right? We looked at the range of motion assessment, the accessory motion control, the rich data that you get with an understanding of how is the spine moving. We talked about joint position error, which is a larger conversation about proprioception in general, way that neck proprioception is formed, the different processes by which it's integrated, and some findings relevant to the joint position error test. And then last, we're going to bring it home with sensorimotor control via the butterfly test. This is the test that started it all, right? Butterfly test is how NeckCare came to be. And physical therapists were endeavoring to quantify function of the neck and had to design a test by which they could do that. So go back and listen to our episode with Ori, where we discussed some of the history of NeckCare and what it has to offer, because it's really fascinating. And actually, this research goes back over 20 years, on this particular assessment. So the fact that, we can plug and play and run with it now is really, really cool. But this is one that it all kind of comes together, right? So we've got different sensory systems involved in the performance of this test. We've got, the correlation. We're building a case over the series of assessments for the dysfunction of the cervical spine or not, through range of motion, joint position error, and now with the white buffalo, as Cameron would say, the sensorimotor control of the neck. So I think a good way to start with this one would be just to maybe define what is sensorimotor control. Like, what does that term mean? What are the systems involved with that when we're looking at this butterfly test potentially? And then we can go from there. So one of you guys want to first tackle the definition of sensory motor control?
We'll let Chung take that one.
Definition?
Yeah, that's the key.
So sensory motor control is, if you want to break down the word, it says exactly what it is, right? So like from a sensation standpoint, when you're doing this test, all right, so just for like painting a mental picture. So you got the NeckCare device onto the head. It has a sensor and you are following a moving target that is on a screen in front of you. So what's involved in that? Your visual system has to be able to pick up what the target is doing, and you're following this dot. So your eyes have to be able to reliably follow the dot in a accurate and velocity dependent manner. Your brain has to be able to predict where the target is moving next, because our heads are not moving instantly to the place where our eyes do it. There's always a latency. There's always a little bit of delay. And then the brain also has to send a signal into specific neck musculature that is going to be reliably accurate to where the prediction of that target is going to be. So this is really a wide-ranging integration of how the brain is taking in information from the eyes, movement and prediction capacity of the brain. And then also, when you make an error, are you using the feedback from your visual system to actually correct the error and put your head back on the target? And you're going through different difficulties. So can the person perform it at a very slow speed? Can they do it at a more medium physiologic type speed? And then you have the higher performance, fast speeds of these movements. And that way, when you're doing it across these 3 tests, you can see, is this a speed dependent breakdown of function? Is this something where they are making specific errors involved? Like if they're consistently overshooting the target or undershooting the target. So you're looking for aspects of hypometria or hypermetria involving some of these neck muscles. Or can they even hit the target at all? Are their eyes visually perceiving it? Is their head movement driving their eyes off target and causing them to be inaccurate in there? And there's also these aspects of, do they have another brain issue? Do they have a head tremor, like an essential tremor, where they actually have a movement disorder that is compromising some of these results? Because one of the cases, like we looked at, I think the forum I published, I had Ori show a case with Parkinson's where you could see like, the head was tremoring basically throughout the entire test. So you're looking at multiple aspects of brain and neurological function in response to how your brain is controlling your neck muscles, and also what the information inbound is going to be through your visual system.
Yeah. And this one I think is a little bit more true to life than maybe something like joint position error, because we're constantly doing that, right? Our eyes and our neck are constantly in a state of, sensing the world around us and moving in response to environmental stimuli and so on. So I tell folks all the time, like, because this is one that experientially is difficult for folks, right? And so we'll pull up an exam and you'll be able to see here on the video a replay of the butterfly path and the patients following the path. But folks have a hard time with this. They get frustrated because it's difficult to do. And I tell them, this is really hard to do because we're teasing out some very, specific, instructions on this, but you are doing this day to day. You're driving your car, you're working on your computer, you're cooking dinner, you're playing with your kids. Like, these are things that are happening moment by moment, day to day. And even just on a musculoskeletal side, again, building a case, if we just saw that someone had an extremely restricted or painful range of motion, and then this task takes them into that direction, we're going to see a breakdown there. So it's kind of interesting as a sort of like capstone on our, assessment of neck health, to go, let's kind of put it, big picture, real world scenario with some really complicated things, right? We're not pointing to one particular little, muscle here or listing or position or system, right? It's a big picture assessment here. And it's one that is very experiential and very interesting to observe patients perform as well.
It's also one of the, in my experience at least, it's also one of the most frustrating from a patient standpoint when they ask, well, what's wrong? And I'm like, well, it's called sensorimotor integration. And then I spend 10 minutes, just like Chung did, explaining all of this. And well, you've got all your stuff. It's, but Jon, you said it perfectly. It's the most real life. And I think that's really important. We do all these tests, right? That it's like, how does this fit truly into the patient's real life? This is it. This is absolutely it. They're moving their head, neck, and eyes all day. It's also one that I think is going to really help determine for clinicians, is it, you have to ask the patient, did you feel dizzy in any of this? Trying to determine, is it head movement? Is it eyes? Is it neck? Did one of these going faster, was it worse than the others? Like, just kind of using just a couple questions to hone in to better potentially diagnose or understand the genesis of whatever the patient is experiencing.
And just in the performance of this test too, I kind of like to stand off and to the side a little bit so I can watch the patient, but I can also kind of see the screen, what's going on. And it's really interesting to watch how folks attempt to do this, right? Some people, you see a lot of this, they get real hunchy and they lean towards the screen and they squint, they hold their breath and they get really tense. And other people give up really easy and they get frustrated. And it's just, a lot of interesting insights into the patient and their perception of how they're doing and what it means to them too. But as we're talking about like the actual assessments, Chung alluded to this, but there's 3 assessments. They're labeled as easy, medium, and hard. Right? It's about a 30-second assessment where there's a dot that travels on the screen, and there's a cross or a plus sign that represents the position of the patient's head. And they're attempting to match the pace and direction of the moving target by moving their head. And I don't know how you guys preface or describe the test, but I always tell folks this is like a test of neck dexterity. And I always give the example of my 6-year-old son who's learning how to write letters. He can trace the dotted lines, and it's okay. But when he's freehanding, because he doesn't have a lot of experience, he hasn't developed the control and the thousands and thousands of reps to do that smooth. Sometimes it's a little choppy. Sometimes the shapes are a little distorted. It's not something that's well learned by his brain. And sometimes when you have a brain or a neck injury, that dexterity is compromised. And we can see that evidenced by the way that you execute movements that should be relatively smooth. You've moved your head in these directions your whole life, right? So if we're having trouble with it, that's a clue that there's something wrong. So on the screen here, if you're watching on YouTube, we can see the patient performing the first rep on the easy, quote, easy assessment. And these are about 30-second assessments that we run. I do them in a randomized order so the patient doesn't anticipate easy, medium, and difficult. And Dr. Chung's playing a playback here, and it will quantify the average amount of deviation, right? And in version 1.0, I guess you could say, before the software update, it would give you kind of a bar graph and would illustrate where folks fell in sort of the normative range and their percent of on target versus ahead or behind. That was great, but honestly, I think watching the replay and just observing the performance of the test is way more compelling to the patient, number one, but also just as a review of like, okay, exactly how did we get from here to there, and how did it go down?
So this is a patient that has had multiple concussions. She's been a while after the concussions occurred, so she's had a lot of cervical spine issues, and she has multiple sensory dysregulation that's going on, whether it's vestibular, visual, all this type of stuff. But some of the things that you could kind of see, especially on the slowest version of the test, like she was very consistently hypometric. Like her head was always undershooting the target. And then once the test started having this like moment where it starts to go faster, like she just lost it and then just had to move her head to try to catch up with it, which is where you see like there's this big gap between what the actual target line drawing was and where her head ended up moving along that pathway. So even on the easiest version of the test, which, I would say the vast majority of the people should score fine on the easy version of the test. Whereas obviously as the test increases in difficulty, like it wouldn't be unusual for the first patient's first time doing the test where they have a relatively poor performance. And that's kind of how I preface it, because a lot of people will say, is anyone actually good at this test?
Yeah.
Yep,
and then, like
all the
I'll
time.
show them my test where I have green, and yellow on there. It's like, yeah, if you have a healthy cervical spine function and healthy sensory motor function, like you can be good at this. But as of right now, your test is underperforming. And our job is just try to use the data from this and help to improve the overall performance on it. Because this doesn't tell us like, do you have pathology? This just tells us like, hey, your brain is not able to track a target very accurately with your head. And that is something that is really important when you're navigating through life, because like you said, it's a real life thing where we are constantly moving our head to see things and to interact with the environment around us. And having good neck accuracy and neck function on it is probably a healthy thing for you to experience, especially if your chief issues are related to dizziness or disequilibrium or some type of motor function like that.
Yeah, I explain to patients that the head and the neck are like the steering wheel of the car. Where you turn the steering wheel, the car is going to go. And so if there's dysfunction there, or there's some sort of mismatch between the steering wheel and the rest of the car, you're going to potentially have some catastrophic issues. That is always, and I think that's really important to go back to, is what Chung said. Patients, almost every single patient I have when we did this test, they say, well, does anyone do good at this? And it's
Yeah,
like, well, no,
like you're
most people
tricking
don't.
or something.
Yeah. Oh, well, sometimes you get that patient who's a little bit of a honey badger, and they're just kind of like, well, yeah, they just kind of, just poke at you. But like, no one in our practice almost no one comes in with a healthy neck, right? People don't come to our practices just because they want to, quote, it's very rare, but they want to just get checked out. So no, most people aren't going to have a good sensory motor control until we help them. And then we redo it and it looks better.
It's always kind of interesting too in the folks that you anticipate this test being a train wreck and then they actually perform fairly well, right?
Yes.
So for me, when
Yeah.
I'm looking at like all the findings together, if I'm seeing someone that has like a lot of range of motion issues and a lot of musculoskeletal pain and headaches and just like stuff like that, but their joint position error is decent and their sensory motor control is decent, I'm like, you're probably going to really like when I adjust you. Like we've got the stage set for really like, let's say simple starting point as far as like our management. And then when everything's all over the place and this is, elicits a lot of symptoms and, the history is really muddy with a lot of, like lack of clarity about mechanisms of injury and things. These are ones where I'm a little bit more cautious about, setting expectations for, okay, how much is my adjustment going to, change your day-to-day quality of life and how you're feeling. And then we have conversations about referrals and other strategies and things like that in the beginning. So that's just for me personally, as I'm observing this as, again, kind of the capstone to the whole situation, having talked with a patient through their history, having an idea in my mind about what I think is going on, and then verifying through the course of testing, like, are we starting to accumulate evidence that what I think is going on is actually potentially going on or not? That's where this really helps me kind of tie a bow on things at the end of the assessment and say, like, okay, we know we've got some positional issues. We know we've got some movement issues. Like, how much of it needs to change for you to feel better kind of just depends. Like we at least have a baseline, a starting point for measuring function over time. We may bring in some different strategies based on what we're seeing here. Like maybe there's some exercises that need to happen, maybe a referral, maybe another part of your history becomes a little bit more important now. And we can at least do that with some evidence, right? Some data to start thinking through that decision making. But again, I don't overemphasize any one of these tests as I'm going to fix this test, right? Like
Yeah.
my adjustment is going to make this work perfectly. And that's what it's going to take for you to live well. It's really not the main objective. But what have you guys seen as far as down the road as these things are improving? And let's say for a butterfly test, you're adjusting, you're working the musculoskeletal system, maybe not seeing the butterfly test improve, or maybe consistently eliciting symptoms or having other trouble with that. When would you start to implement other strategies, or how would this test help you think about a referral or other strategies to use?
I think it's really interesting the comment about like eliciting certain symptoms. I see a lot of patients. We do well with dizziness patients, and I don't have a single patient that I can think of in almost 2 years that I've been using the butterfly test. And I ask every time, did any of that make you dizzy? I have not had a single person say yes. Not a single person has said, yes, this made me dizzy, which is kind of mind boggling. But on the flip side of that, someone who, another upper cervical chiropractor who got NeckCare, his first patient, they had to stop because they ended up vomiting because it made him so dizzy. I'm like, man, what is going on here? But no, if this,
I've had
in
3
my
patients that had to stop midway.
really,
Yeah.
God, maybe.
The
Well,
the
he's in Florida. The other guy's in Florida. There's some in Florida, man. Maybe North Carolina. I don't know. They're okay.
the very motion sensitive patients, so patients that have they have like really aggressive car sickness, so especially like the vestibular migraine type patient who's very susceptible to motion sickness, like this is a test where depending on the severity of their motion sensitivity is likely going to overstimulate their nervous system in a way that will make them feel quite sick during that test. But it also is a good benchmark because when we help them with their vestibular migraine, like they complete the test and they were fine, which is a nice marker of improvement, even though we don't actually have the data from when they failed it.
Now, when you guys are observing the different levels of difficulty as it's set up, do you think differently about, let's say, someone who does fairly well, let's say on the medium to faster side, but on the slower test had the most trouble? What would that raise your suspicion of?
I would say there's probably some issues with gaze stability involved, and you could correlate
Yep.
that with if you had like goggles and you like occluded their eyes, you would probably see some aspects of nystagmus, square wave jerks, things along those lines. And there's some people, and I see it with smooth pursuit testing, there's some people that the slower the smooth pursuit, the worse their performance is, where if you get them moving faster, and all of that probably links back to there's a gaze stability issue that's probably at stake in some of these patients.
That I thought the exact same thing, and I still agree with it. But as you guys know, I'm unhinged when it comes to trying to understand some of this stuff. So within like 6 months of purchasing NeckCare, I was like, man, how do we know if it's the eyes or not? So I spent an unbelievable amount of money on a pair of glasses that has cameras. So now I have patients, when they do the butterfly test, I'm able to see their eyes, which is pretty amazing. And I thought I was going to see all this neurovisual dysfunction. I've seen maybe 5 cases where they have neurovisual dysfunction. And so but having right eye, the device that is the neurovisual infrared tracker, they have shitty pursuits or something like that. And so it's like, where's the disconnect? And so this has really like challenged my thinking of what the hell is actually going on here. And at first halfway through all of it, I was thinking, this is definitely a VOR thing, right? It's vestibular ocular reflex. But then I realized, well, wait a minute. No, their VOR is healthy. Because if I'm replaying
correct.
the video, you're seeing their eyes on it, but the eyes are stable, but the head is doing this. I'm like, oh shit, they've got a good VOR. Where I think I'm at right now, and correct me if my thought process is wrong, I think it's the vestibular colic reflex. I think there's something going on with that reflex, which from what I understand in the research is poorly understood relative to the VOR. Because bringing it back, Stenberg, to what you said in terms of like when it's horrible on slow, I think it becomes more of that colic reflex of their stabilizers just can't, their intrinsics in the multifidi just can't handle that slow, steady movement. I don't know. This is, like you said earlier, it's the white buffalo test. It's the sexiest one. And the fact that we now have the replay is a huge thing from a patient education standpoint and an understanding of like, or do they have trouble maintaining the speed, right? So like the kid who's learning to drive, gas brake, or are they all over the place with the steering wheel with the deviation? I think this test in 10 years, once we have more data, actually it'll probably be like 3 years, but I think this test is going to help us understand the sensory motor integration system more than we ever could have imagined, because of the more people, the more clinicians we have doing this stuff, the more data we have. I think it's going to be easier to data mine and be able to say, here's what we think is working, here's what our current thought process is, or here's what it was 5 years ago, versus, I thought it was VOR, I thought it was eyes. No, I'm thinking it's vestibular colic. Like this to me, there's no end in sight with what this could help us with. But it's still a little, it's not as sticky right now. It's a little bit abstract.
Yeah, makes sense. And, for folks that are listening, like obviously upper cervical chiropractors are using NeckCare, MDs using NeckCare, some ortho docs. You've got PTs using NeckCare. You've got, PI clinics of chiropractors, MDs, and PTs using NeckCare, right? So the data will be coming in from a variety of different interventions. And it'll be really interesting to see over time, what sorts of strategies are improving this test or having an effect there, and what that might mean. But the good thing for upper cervical chiropractors is like you don't have to overinterpret it, right? Again, with all this stuff, to Chung's point earlier, this has been stated in both of the previous two. This is not a subluxation indicator kind of a conversation. It is a conversation of the function of the cervical spine. And patients, this is one of the things I tell folks this all the time. Like, you are not a lab rat. Like, you are not the type of specimen where we can very specifically isolate all variables out except for just the thing with your neck, that I'm attempting to correct. Right. So in the general scheme of things, like I tell folks all the time, it's like, your car goes out of alignment, you put it up on the rack and they put it in alignment and then you drive away and it's all great. It's like, I'm trying to align you on the fly kind of a thing. Like, we are attempting to change the structure, change the function, change the integration of this stuff, like in real life conditions, while folks are out doing a lot of other things that are affecting this.
Hitting
Right.
potholes.
Yeah, right, exactly. And bugs on the windshield, you got the change in stations. So again, don't overemphasize the effect of a misalignment of the cranial-cervical junction
That's
on any of these things, right? But they do, if you intervene, if you get someone cleared out, if your post films look great, your Titron scans look great, your other outcome assessments, your posture looks great, and you measure this and you see consistently that's actually translating to more improved function of the neck. It is actually translating to healthier conditions. It is correlating with, those times where folks symptomatically aren't doing as well while those other things are improving. These are just observations you can make and gives you some fodder for clinical decision making, but also just, sort of trending over time, the health of the cervical spine. And it's all very contextual to the patient, right? Like even some of those motion sick patients, it's like you explain to them what they're going to do and they're already freaked out that this is going to make me dizzy. Oh my God, it's going to be triggering. Like, there's a lot of layers, of how this stuff plays out. So there's all these conversations about, putting data in Chat GPT and having it spit out some sort of treatment algorithm for you or some sort of conclusion. And I think that that's insightful, but it doesn't eliminate the role of the doctor in thinking through the whole situation and making it contextual to the patient.
Not yet.
So I think a good thing to pull on this is when you look at motor control as a totality, not just the neck, the fitter and healthier you are, the better your motor control performance is going to be. Like,
absolutely.
If you take a gymnast and they have some type of neck issue, they are still likely to perform a little bit better on this test than if you took someone that was unfit and had, supposedly a healthy neck, like their performance on this is going to stink. So I think it's also kind of like, we don't necessarily have the data to support this, but I think it is one of the things that we kind of know intuitively is like, hey, if this person is healthier and fitter, their ability to integrate all of their senses and the ability to control their muscles is likely going to be better, just as a net result of being a healthy, fit individual. And I kind of have this conversation with patients as well, is just like, we're testing this because it does give us some information about the health of your neck in totality. But also, like, if you're not performing well on this test, sometimes it's just a general health metric of how well do you move all of your muscles, kind of like how grip strength is a surrogate for total muscle strength.
Mm-hmm.
Like, that doesn't mean that we're going to train you to have a stronger grip. That's not the point of that test. It's to say like, hey, you are a little bit too weak for what your age appropriate standard is, and this needs to get better. And if someone is having like a lot of difficulty on a test like this, like obviously fix whatever's going on in their neck and see what's left over. But let's say they're symptomatically feeling better, but that test still stinks. Like, it gives us a little bit of room to say like, hey, if we want this test to get better, and it's not that we have to chase the results of this test, but it's a little bit of an indicator of like how muscularly fit you are from a total health standpoint. So let's talk about what can we do to encourage healthy behaviors. So like, what are we going to do to help improve your general physical fitness? Because just improving your physical fitness is probably going to be helpful, not for just this test, but it's a good reason to just get generally physically fit overall. And if this test improves with that, then great.
Yeah.
But it's one of those places where it could open the door for that conversation, in my opinion.
And even your history and your initial interactions with the patient will paint that picture for you, right? If it's someone who's deconditioned with chronic neck and shoulder pain, they spoon fed you that intel. If it's a, relatively fit person with an acute issue, maybe that's a little bit of a different interpretation of the total picture, to your point. And that's why we can't necessarily take any one of these individual assessments and say, this is fill in the blank, right? It is in totality. And I think that's the beauty of it, is it doesn't have to be something where we say, well, in the right lower quadrant on your, butterfly test, you consistently were restricted, and then we saw that the right joint position. It doesn't have to be like that, right? As chiropractors, upper cervical chiropractors, I think we're inclined towards specificity, but sometimes, to your point, Doc, it's taking the step back and looking at the totality of the situation is where the specificity, actually kind of matters. And again, like without talking about CPAs and APAs and all that kind of a thing, it's like, you're better off being healthy. You're better off with a more robust musculoskeletal system. Like, and I tell folks all the time, I just had a conversation with a patient about this, because sometimes folks get very, and I think the algorithm fuels this. They think that there is a specific exercise to make this better, right? They give me the thing I can do to pass the test. And it's like, well, that's not really the point. And I had a conversation with a lady the other day who's been really babying a bunch of problems and trying to find the perfect passive modality that'll just take this chronic thing away. And it's like, you know what? I don't think you need to do anything specific, right? Like, you need to just get going, do things that are fun. You got to make your system start to get those train chugging down the track here. Like, who cares? Like, I could give you neck exercises, but that's not going to move the needle.
Yeah.
Right? Like, build a foundation so that those specific things have more purpose. But to Chung's point, it does open the door, and we talked about this with range of motion, to a conversation about lifestyle factors, the things we call the chiropractic lifestyle, these other aspects of health that we as, musculoskeletal clinicians, chiropractors that are doctors of the nervous system or whatever you're calling yourself, right? It opens the door to a conversation about a lot of topics that are related, but are also important in a lot of unrelated aspects as well. And doing an assessment of moving, having someone go through this experience of like, man, I'm not good at moving. It's clearly evident that my muscle system is just not really working as well as it could, or maybe should, or I want it to, right? Like, it starts a conversation. And so whether you go down the rabbit hole of intense cervical rehabilitation kind of a things, the neuro rehab, whatever, conceptually, I think what you just described there is a really nice entry point for a lot of us to go, talk to me about your activity. Talk to me about your life. Like, what kind of things are you into? What are you doing? Well, I work, and then I drive home, and then I put my kids to bed, and I watch movies. It's just like, well, again, adjustments are going to help you. We're going to facilitate progress, but what are you going to do with that progress? Like, how does it translate to your life getting better? Sometimes we have to have hard talks with folks about the fact that, it's not our job to fix everything for them. And even with the best laid plans, this information requires some engagement on your part, right? Everything that we're measuring here is going to require your participation in a doctor-patient relationship to help enhance.
Yeah, so piggybacking on that, and I have two kind of general thoughts. Like obviously people don't need to do CrossFit, but CrossFit has these really great principles of what makes an athlete. So athlete has several domains. It's strength, speed, endurance, agility, coordination, all these other things. And those are really great benchmarks that we should have a lot of people just aspire to just as a general health. And this, like, one of the things that we're getting from this is like, how well is the person coordinated? And if they don't have great coordination, that's one of those things that, like, it's a trainable component of just general life, not just the neck. So that's one of the places where, like, I like to talk to patients about it. Is like, hey, we want you to not only be strong, I want you to have good metabolic capacity, because those are really healthy things for the brain. But also, this is a test of coordination. Like, how many patients come in and say, like, yeah, I'm always bumping into stuff on the right hand side, or I feel like I'm clumsy and stuff like that. It's like, well, do you want to do something about it? And if you do, like let's have you like practice things that actually improve coordination, because that is therapeutic for the brain as a whole. It's not something you have to chase down. It's like, oh, we have to do this like right brain, right cerebellum type thing. Like, no, just make the person more coordinated by doing some like moderately challenging things that challenge that coordination system. And the other thing I would say is like, and this is where like I think PTs get it right, especially like the strength centered PTs, is like everything is about progressive loading. And when we want to progressively load the neck, like I think one of the coolest things about this is that we could give someone the lowest level of progressive loading just by having them do these butterfly exercises. And then we could progress them towards actually doing some strength training for the neck to build up some of that muscle tissue that, you know, will hopefully help them prevent them from getting injuries in the future.
Yeah, if you can see a win on something that feels important to you, you know, as a patient, and start to build some confidence that like, okay, I'm actually seeing that I am improving, you know, and this very low barrier to entry, like, you know, not perceivably dangerous neck quote exercise is something that I can see progress with. Is that segue into, you know, more confidence with strategies that seem a little bit less approachable. You know, like you don't have to be a meathead, but if you're a person, you know, health is about options, right? It's about having the capacity to live life on your terms. And we need to rely on the physical body to do that. And the body needs to be, you know, in conditions where it is, you know, has to rise to the occasion. And sometimes that's a hard thing for folks to wrap their head around, but it's our job to, you know, help emphasize and coach them along in that, and build the confidence, and as a springboard to, you know, not just our results on our tests, but with patient quality of life, and just with their total health.
There's this is all great, by the way, but there's a but. The biggest piece of information and feedback that I've gotten from other docs who are interested in NeckCare, and even from NeckCare, the company themselves, what do we do with all this data? So like this philosophical conversation, I'm overflowing, you know, like I'm dipped in. But truly, what because this stuff are things that we didn't really learn in school all that much, or not all packaged together. The biggest question from a, you know, potential client of NeckCare or customer of NeckCare, and of course patients, is like, well, what do I do with all this? You know, like, because there has to be an inherent value. You're purchasing something and you want there to be value from that. And I think that there's a longer conversation of like, well, you should assign the value to it with, you know, how you use it and interpret it. But like people want to know, and rightfully so. Okay, if there's a right joint position error, what do I do about it? Whereas our conversation here has been, well, we have data, treat your patient, and then see what happens. I think that's going to go well for a group of folks, but there's other folks who want to purchase this product, and they want essentially to know if this, then that. And I don't know that we're there yet. I think we could get there in the future. Yeah. I know we'll get there in the future. But as it stands right now, I think we're kind of on the spectrum of we have this piece of technology that we've never had before. And it shows us the global, as Chung put it, like global neck health. What is the neck doing? What is range of motion? What, when your eyes are closed, like joint position sense, fine motor control, what is all of this health? And as someone who takes it way too deep, I'm going to come back up to surface level and say, when you purchase this, because I think a lot of people are going to purchase this, and they already have, but I think more people are going to purchase it. Don't necessarily dive in and be like, I have to understand if there's a right joint position error, what does it mean? Use this as just a way to get more data and then quantify what you're already currently doing. And if your intervention doesn't do, you know, what you thought it was going to do, you have to ask the hard question. Is this the right intervention relative to their chief complaint? Do we need to do other things, or do I need to refer them out so that these other things can be done? The tool is going to be beneficial regardless, right? It's going to give you the data to be able to make a better informed decision. And so I think on that regard, this should be in every upper cervical chiropractic office around the world, especially North America. And when it comes to PTs, we have an opportunity here to understand what the physical therapy group is doing with this relative to what we're doing. And we'll have the ability to come and meet together and say, okay, here's our results, here's your results. We may find that they get tremendous improvement with butterfly, and we don't get tremendous improvement with butterfly. So there's a learning opportunity so that we can enhance our understanding of when it doesn't go the way that we want, where do we need to send our patient to get them the outcome.
That's a great point, and it's not a unique question to upper cervical chiropractic, right? It's neck rehabilitation in general, making sense of what these assessments mean and how we dictate patient care based on the data that we're collecting is an ongoing topic of discussion.
It
And
is.
by the way, Dr. Bearder and Dr. Chung both speaking at the Advancing Neck Care, is that what it's called? Symposium or conference?
Advancing
In
neck
Reykjavik.
rehabilitation. Yeah.
Advancing Neck Rehabilitation in Reykjavik, Iceland in May. I'll be there. They'll both be presenting. There's going to be a multidisciplinary mastermind, basically, of folks that are in this world that are going to be having these conversations, that are going to be bringing the data to the table and sort of like sharing their initial findings. And it's going to be a really, really, I can't think of an event that I've seen like it before. So I'm really excited. Iceland's awesome. So I've heard. I'm excited to be there with you guys and to continue to carry on this conversation, to network and to connect with other folks that are also having these conversations within their professional boundaries, start to break down those walls a little bit, have conversations across the boundaries. And together, we're going to go far with this stuff. And it is a relatively new, thing to market here. So again, to summarize, like part 1, part 2, part 3 of this, the idea was to give you guys the insights that we have gathered over the last year of collecting data with NeckCare, of managing patients with this information. If you were expecting us to say, to Cameron's point, this test plus this test equals this, I think you can see now that that's really never the way that we were trained in the first place, right? You get a leg check, you get your Titron scans, you get your x-rays, you talk through your patient, you have to put it together. And it's okay if you don't have like a really firm grasp on what do I do different because of this assessment. That's okay. I think what we've summarized in each of these is gather the data, collect the information, get the intel, and monitor the general health of the neck over time with very specific metrics. And that's a very cool opportunity that we have because the price point, it's a low barrier to entry. It's very user friendly. It's very intuitive in terms of like the patient's experience of it, reviewing the results. Like you don't have to over-interpret it, but I think there's a tremendous amount of value there. And hopefully folks have gathered some insights from us as to the value that we see, the way that it's benefited our practices and our clinical decision-making, or at least, open the door to deeper conversations. And again, if you have questions, reach out to us. We like talking about this stuff. We obviously don't have all the answers, but, let's carry on the conversation together. We're going to get closer as time goes on. Any last words as in summary of just, the assessments in general? Any last words or comments on sensory motor control or sort of ways to, wrap up this 3-part series from Dr. Bearder first and then Dr. Chung?
Well, I'm first. No, I think we did a pretty good job. I think we got bird's eye and then we swooped in and we caught the fish, so to say. I really don't have anything else to say other than the device is great. The software is great. The company is even better. Folks who have followed along long enough have heard me talk about NeckCare endlessly, not because I have, a 10% discount for every referral. I don't actually. I just really enjoy this product and the company that is interested in helping us quantify our results. So that's just kind of my plug. I think the data, we're in the early stages. There's no reason not to be involved in this, even as a collective, truly. So get off your asses, Let's do it.
So I was actually having this conversation with another neuro that's local to me, and she was actually talking to a NeckCare rep, and she was asking me about it and why it would it be applicable to her, just knowing what I know about her practice. And I was just honest with her. I said, like, you have all these other tools from a chiropractic neurology standpoint. Like, you probably don't really need this particular tool, because I don't think it changes the way that you're going to practice. And I don't think it adds any additional information to your specific practice. On the flip side, where I was talking to her about why I use it, and a big part of that is, like, I'm an upper cervical chiropractor, and part of what we should stand for is we should have this high level of expertise of all things related to the cervical spine. And if we are going to set ourselves apart as being these people that know what there is to know about cervical spine care, then it's prudent for us to be able to measure all the things that we say we are doing for these patients. If we say that chiropractic subluxation is about proprioception deficits causing disafferentation, and we are not measuring it, then what are we doing? Like, we're missing some of that as a not only just like a branding thing, but just also just like, are we really looking inside of ourselves and telling patients the truth about what we are trying to establish for them? And on the other side of it is, all of us have different skill sets. Like, some of us practice very strictly within our technique confines. And yeah, maybe this tool isn't going to be quite that useful for you if you're not willing to budge off of, yeah, my care plan for you is you're going to get checked and adjusted, and you're going to do that for twice a week, and I'm not going to give you any advice. I'm not going to give you any type of recommendation besides just to come in and get adjusted. And if that's your way of practicing, like, this is just going to be an expense for you, and it's just going to be a marketing tool for you. It's probably not going to be that useful. But if you're someone that is thoughtful as a clinician, and you're just trying to look at other ways to help improve your ability to take care of people, then this is a way where you could take the data from this. And like I said, we don't have all the answers quite yet. But if you are someone that does, AO, and you also like do, some type of SOT technique from time to time, and you have this other way that you work on the cervical spine, like, you have a doorway to be able to say, like, hey, does this type of maneuver that I'm doing in SOT actually help this joint position error on this person where my upper cervical adjustment didn't? And you're just accumulating ways to be able to innovate and figure out ways to help people beyond this technique algorithm that we're all taught. Because I think it's one of the biggest things that you'll probably get from listening to this podcast is, like, we are not algorithmic people. And we can make a case that, like, algorithmic types of practice is just like, it's not really that great for patient care, because we're losing sight of the fact that patients are individuals, and there are lots of people that have really great knowledge that they could add to this. But if you're not measuring it, then how do you know what we're doing is having the impact that we think that we're doing? So I would say, if you are a really thoughtful clinician and you really want to explore what is going on when you're taking care of a patient with the variety of tools in your toolbox, and obviously for me, it's neurology. For Cameron, it's neurology, as well as this super in-depth way of looking at minute changes in the cervical spine. For Jon, it's the ability to, like, talk to patients and see this biopsychosocial type of aspects and how to refer to get best care for people. Like, there's so many ways to integrate the use of data on the health of the neck in order to enhance the patient experience and the quality of their life. And I think that's where, if you have that as part of your underlying philosophy, not just the chiropractic philosophy, but the philosophy of just taking care of people, then this is a really great and valuable tool to be able to enhance that ability for you.